Our next speaker is Dr. ANAND Parthasarathhy. Already introduced to him. He's from the Center for Vision and Eye Surgery from Chennai. Dr. ANAND Parthasarathhy is going to speak on Smile All the Way. It's basically on lenticular surgery.
Thank you so much, Dr. Vinod. No financial interest, but it would be nice to have some. So basically, when you look at biomechanical stability, we know the anterior 2/3 is an important part, and that's the reason that Smile has better outcomes in dry eyes, and that has been proven by confocal microscopy. There are of course some disadvantages. One is basically the cost factor, the technical difficulty, and until the energy is optimized, usually the recovery tends to be slower. There are some disadvantages, which is basically the cyclotorsional compensation, which requires a manual correction. I will skip this because it may not be relevant. In terms of choice of preoperative workup, we find that anything between minus 0.5 to about 5 sil works. A good cycloplegic refraction may be a good idea, and you follow it up with a confirmative subjective refraction. The broad outlines for fitness for Smile are the same that you would have for LASIK or for femto-LASIK. Now, there is some settings for standard mode and fast mode, and the energy settings can be put between 150 nanojoules, so 120 to about 180 nanojoules. These are, if you are actually starting off, this is something that you would probably need to check before you actually start the procedure. The good idea would be to start with standard energy settings and gradually lower the energy settings, because that we find helps in faster visual recovery. There are 3 cone sizes based on the white to white, which is small, medium and large. And for our cornea, the small works majority of the time. Just before the procedure, useful to brief the patient so that they understand that what they're going to get. The amount of pressure that a patient faces is significantly less, and always, sometimes even like for femto-LASIK, you got to make sure that the nose doesn't come in the way. Once the blinking dot, basically the fixation light is green in this, the laser application takes 22 seconds with the older machine. The newer one is about 8 seconds. The drying the surface is probably the most crucial step. It needs to be just moist. If it's too dry, you will end up with a lot of black spots. Just a short procedure, how you make sure that you dry the procedure. You make sure you go to the pharmacies, dry it, and then just wipe the cornea in the upper and lower part, so that you do not have a very wet or a very dry surface, but err on the side of wet, because that works much better than being too dry. Usually this gets this thing. Now this is to dry a surface, so you will have difficulty in the dissection. So this is important to identify pre-operatively or during the procedure itself. This is a perfect laser pattern where a uniform size of the bubbles, and the dissection tends to be a lot better. Docking is important. Opt for a soft dock, that means you don't go and bump on the cornea, and usually activate suction at 70% of the applanation. Check for the pupil centration, and if pupil is not centered, you need to adjust. This is an important part of the procedure. Make sure the whole the ablation part is centered on the pupil. It may be slightly nasally decentered, it is not a problem. So this is what we mean by a soft dock. So you just make the patient fixate on the blinking green light, you touch and activate the suction, and the procedure then proceeds. This is how you want it perfectly. The dissection is good, the energy pattern is very good. The lenticular dissection technique, remember this is the outer and the inner circle, and the difference is about 0.5. So this is important because this is where most starting surgeons tend to have difficulty. So first you open the superior pocket, then you go to the inferior pocket. So that's how it needs to be done, and you stay within the cap. Just a short video on how that is, what I mean by that. So this is the bubble pattern, a few slightly dense bubble pattern. Open the pocket, go inside, superior one first, and do the dissection on both sides. Then you go to the inferior part, so you start at the edge and then switch the instrument and then complete the anterior dissection. So here we have already completed the dissection of one part. Now we are going to go for the lower part. Now once you've got the plane both anterior and posterior, you use your instrument, complete the anterior first. Remember, in SMILE, you do the anterior part first, and you can take your time and do it very gently. Of course, slightly easier if you're a corneal surgeon because you get a feel of the cornea earlier itself. And go to the edge, the whole edge of the cap. And now you got to go do the posterior dissection. So if you happen to do the inferior dissection first, the whole cap gets stuck, then you will have more of a problem of dissecting the cap. So this is how you go under. Now you've already created the pocket, you go under, so the feel is different. If you have not got the cap, you got to feel a bit of resistance when you're doing the inferior part. You don't need to do the complete dissection. Same thing, be lot more gentle over the pupil, because that's where the important part is. If you're not gentle over the pupil, you will have abrasions, there'll be irregular surface. The edge dissection is important, so I don't do a complete edge dissection. So once the central part is complete, move the lenticule at 1 o'clock. Then you start separating the edge. So move from 1 to 5 before you complete the whole dissection of the procedure. So here you go on one side, so 1 to 5, about 5 clock hours. Now and so that you have an attached edge. So this is what we call a central island. So this helps you prevent the rolling up of the SMILE lenticule. So you go to the edge, go around. So now you got a central island, you got dissection on this side and that side, and now your SMILE procedure is almost complete. This is the last part, which is the lenticle extraction. You complete the whole part, all the attachments. So you remove the central island, you go to the edge, and now the dissection of both the anterior and posterior surfaces is done. And now you go ahead with your forceps, ask the patient to look down, pull it away from you first and then pull it out. Now I've broken it down so that the whole procedure can be shown, but if you do it stepwise, usually doesn't take more than 2 to 4 minutes. This is also just to show a docking, so it needs to be a very soft dock, so that when you're applying, this is almost perfect. So try and do it at one shot itself, and that really helps the outcome. You got to see a bit of lint here, so this needs to be stopped, taken out, and if it's not in the ablation area, it is okay. There are some complications like suction loss, black spots, lamellar dissection, folded over lenticule, torn and retained segments. I'll probably skip through that. If you have time, I could probably just show only the suction loss. So the suction loss is slightly different from a femto, because here the amount of patient effort to leave the suction is very, very less. It is actually hardly, if the patient blinks very tightly also the suction, because the amount of suction required in the SMILE is very, very less. So you have to keep speaking to the patient, and you can see the bubbles coming around. The patient is moving, patient uncooperative. You would need to redock and then go. So depends on what stage of the procedure you lose the suction. You can redock if it's early, and you can recut if it's early. Since we have Dr. Vinod, how much time do we have?
Almost over.
Okay. All right. I'll then leave it at this. In case there is any questions about the procedure, we can discuss it more.
So how much amount of pressure is there? You say it's very, very less. It must be as good as femto.
Slightly less, 20 to 25 is what I was told.
Yeah.
It can go up to 40 depending on how you can adjust the amount of.
Basically, until the cornea is pregnant, you can't do it. So there should be proper.
That is the difference between the femto. Femto needs to applanate and flatten.
Yeah.
This has a curved interface.
That makes things.
So you don't need that much of suction. So cornea is in a natural physiological position.
And how do you ensure that the perfect centering is there in all cases?
So we center on the pupil. There is nothing else.
Nothing.
You center on the pupil, you're done.
Any questions?
Thank you, Dr. Anand, for a very nice presentation. Especially, breaking the video into